Okay. So today we're going to be inserting a bonded RPE. Bonded RPE is used for expansion. It's also used when we have baby teeth, we need to open the bite a little bit, and sometimes it will come with protraction face mask hooks to wear with a face mask. When preparing to bond a bonded RPE, you're going to Profi with your Profi paste, and you are going to Profi, so we would Profi here, 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 same on the lingual, here, 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 both sides. And then when we're done, we would rinse with water and air, of course. Then you're going to, once everything is dry, you're going to take your, of course. Then you're going to, once everything is dry, you're going to check the bite. So you're going to place the bonded RPE in, making sure that it fits well. And you are going to check their bite, making sure that the bite is even all the way around. So you'll put your articulating paper in, and you'll have them bite down and slide side to side. And when you look at it, you want to make sure that you have your blue dots on every tooth. So if you are inserting it and you notice when they bite down that their bite is open and that it's not even all the way around, because you want them touching. You don't want this side to be closed and then this side to be open. So you would use your articulating paper and adjusting the acrylic with a high-speed burr, and then you would come back and you would put it back in, and you have them bite down, and you have them kind of slide back and forth, side to side. And then once you get all of your dots in place, and you can put that in there and see that their bite is completely closed and all teeth are touching, then your occlusion is good. You don't ever want it to be like this, hitting high on here. So if it was hitting high on here, you would adjust your occlusion with your 6s. You want it to be nice and even all the way around on both sides. So once you have your bite proper and they are biting down as they should, you're going to prepare to put the bonded RPE in. And like I said, after we Profi, which we've already done that, you're going to take your cotton rolls and you're going to put one on each side of the cheeks. Then you're going to take your air and you're going to dry lingual and buccal on both sides. Then you're going to take your Assure Plus or your One Step, and you are going to etch, buccal, and lingual of both sides. And then you're going to give it some air. And then you're going to do that one more time. Never putting your One Step on the occlusal, only buccal and lingual.
How long do you apply the One Step?
15 to 30 seconds.
Each tooth rubbing?
Rubbing. And then once you have that done, you're going to do your air. Okay. And then you're going to make sure that you have your cotton rolls in. Now, this is the important part, and like I said, I like to micro etch the inside of my bonded RPEs before I put them in. Gives them a little bit more tension and more grip to keep them in. You don't need a lot of glue. So what you're going to do is you're going to take your clear band lock and you're just going to fill, just put a little bit in there, because remember, when you're putting this in there and once you seat it, you don't want all the extra glue, but you want it to flow where it needs to. So once you have that in there, and I like to just take it and I move it around. And then you would do that on both sides. Now you want to make sure that everything's nice and dry. Your patient will be like this. You're going to take it and you're going to push it on both sides. and you want to press really hard until it doesn't go anymore. Now, once you do that, you want to take your Q-tip and you want to get any extra glue that is around the gum tissue. A lot of times it likes to seep out way back here, so you want to make sure you get back here around, and you want to make sure that you don't have any glue up in this area on the gum tissue. So you want to make sure all of that is out, cleaning it. And then the same on this side, making sure that all the glue is gone. And then what I like to do is I have the patient, I take 2 cotton rolls and I put 1 on each side. And then I have them bite down. Thank you. So there'll be a cotton roll on each side. And then what I do is I have them squeeze as tight as they can onto the cotton rolls. And while they're squeezing, again, you're gonna see that extra glue come out, and then you'll want to clean the extra glue. And then while they're still squeezing on that, then you wanna take your light, and then you're gonna light in the buckle. And then you're gonna come over while they're still biting, and you wanna light on the buckle. And then you'll have them open, and then you wanna light lingual. And then you're gonna now you're gonna go for the occlusal. And I just kind of move it around as I'm doing it. And then once everything is lit, I like to give a pull on it to make sure that's in there. And then I go in there to make sure that there's no extra glue. And then put your bonded RPE.